In this video, we will discuss what an epidural is and what the risks and benefits are of receiving one. First, an epidural is an anesthetic that is used for labor pain. It is inserted in the lower part of your back, and it uses anesthesia to numb the region from your belly button to your upper legs. An epidural is inserted by an anesthesiologist and can be given at any time during your labor. It is given through a catheter that is placed in your epidural space, which is right outside the membrane that protects the spinal cord. It can be managed by a pump or injections of the medication. Next, let's cover the benefits. So first, pain is relieved. What do we know? Childbirth is painful, and what does the epidural do? It relieves that pain. Because that pain is relieved, it can create a more positive birthing experience. For some, they are very anxious about that pain, and then when they receive the medication, that pain is relieved and they feel less anxious, they feel less worried, and it creates for a more positive birthing experience. It allows pain to be partial or completely controlled. So if you're wanting to feel the urge to push, or you're wanting them to decrease the amount of medications as you are going to need to push, you're able to do that, and they're able to decrease the amount of epidural medication that you're given. Next, it allows mother to be awake and alert. So you're able to be alert during the birth of your baby. It allows your body to rest as your body's been working hard during labor and it's preparing for birth. The epidural allows those muscles to relax. It allows for comfortable laboring. You don't have to be in pain during your labor. It allows for a limited amount of medicine to reach the baby. And then it also, just going back to that, if the mother is anxious of labor pains, it can help speed up the delivery, because if mom is anxious, it's going to slow down the delivery. But if she's pain-free, she's less anxious, and then it may speed up the delivery. Next, let's talk about the risks. So first risk, it restricts movement for the birthing mother. If you're wanting to be able to walk around and move around, it's going to restrict that because it's going to be given through your back and it's going to have to be taped to your back. It requires IV fluid. So if you aren't a fan of having an IV attached to you, it does require that. It may also require a catheter depending on how often you're urinating. It also requires continuous monitoring of you and the baby. They want to be tracking your blood pressure. They want to be tracking the baby's heart rate. Another risk is that it may prolong second stage of labor by prolonging the urge to push, especially if the epidural is given later on in the labor. It can prolong that urge to push. It may also make you feel so numb that you don't feel the contractions, which could then increase the likelihood of needing Pitocin to help speed up those contractions and speed up the birth. It also increases the likelihood of using forceps, vacuum-assisted delivery, and episiotomy. And then it can also raise mom's blood pressure, which can then slow down the fetus's heart rate and cause a range in the fetus's heart rate. There's also a risk of severe headaches that can be caused by leakage of spinal fluid. This is very uncommon, but it is a risk. And then some other risks, it can also make the mother feel detached from the baby after birth because she didn't experience that rush of hormones that you experience without the epidural. It can cause newborn to have irregular feeding patterns and disorganized behaviors. And then there are also just other normal side effects that can make the mother uncomfortable, such as nausea, vomiting, shivers, itching, backache, and difficulty urinating. If you're considering an epidural, it's really important to weigh out those benefits and risks and decide what is best for you and your baby and what is best for your birthing experience.